Hey everybody, Dr. Nick here, and in this video we're going to be talking a little bit about what makes us different here at NoVa Spine and Wellness. We like to focus on the structure of the spine, and we do that by utilizing a very unique technique in chiropractic called chiropractic biophysics. Now, this technique is a very heavily research-based technique. It's what's referred to as evidence-based chiropractic. It is referred to that because of all of the research that has been done on it. And chiropractic biophysics as a technique has more peer-reviewed research behind its protocols than any other chiropractic technique that's in use today. And they are continuing to do research all the time. They have a wing of their organization called Chiropractic Biophysics Nonprofit, which is solely dedicated to researching spinal biomechanics, the traction therapies that we do, any biomechanical factors that may influence a patient's spinal condition and how to correct them. So that's one of the reasons that we use that technique, because we want to know that what we're doing is appropriate for a patient. We want to know if it's safe, and we want to know if it's effective. And most of the research has shown that when we correct the shape of the spine, the actual structure of the spine, so the curves of the spine, the postures of the spine, this is what's going to A, help our patients get out of pain, but B, it's going to correct the root cause of why those symptoms happen in the first place. And that's what we really want to get to. We are not just about making our patients feel better. We want to make sure that they keep feeling better when they're done with their active care plan and they transition into wellness care. That way we have done something that's far and above just getting an adjustment. What we want to do is give our patients long-term quality of life back so that they can live their lives the way that they want to. That's why we do this, so that we can help people get back to being the versions of themselves that they want to be. A few things about the structure of the spine. When we have an abnormal structure or an abnormal posture, and that could be a loss of curve in a region, or for example, forward head posture or a forward leaning posture, whatever it is that we find on the x-rays, those are the kind of factors that increase musculoskeletal pain. We have research that shows that it actually decreases how efficiently your nervous system functions. That's the communication between your brain and your body. It literally slows down that nerve signal that goes from your brain through your spinal cord to the rest of your body. We see heightened rates of degeneration, so things like degenerated disc disease, spinal arthritis, an increased incidence of bone spurs and things of that nature. And it's also a thing that will actually make your spine weaker. When your spine is not in the position that it was designed to be in, you're more susceptible to injury, whether that be just over time from degeneration, or if you were in an accident of some kind, a car crash, a slip and fall. If your spine's not in the appropriate position, you're more likely to have significant injuries from that than if your spine was in a normal physiological position. So that's a really big reason why we want to do this kind of care. A good analogy is looking at engineers and how they build certain structures. Bridges, houses, buildings, whatever it is, they are all built and designed in a very specific way to handle the forces that they're under so that they don't break down ahead of time or, God forbid, collapse and cause an incident. Your spine is the same way. It was designed to be in a certain position and shape, and when it is in that position and shape, it is significantly stronger and it just functions better and you feel better. So that's why we do what we do, so that, again, we can get our patients feeling better and we can keep them feeling better. If you have any questions about this information, go ahead and let me know at your next visit, and I'll see you guys on the next video.